So first, let me introduce Dr. Christina Canil. So Dr. Canil is a medical oncologist, as many of you know, at the Ottawa Hospital Cancer Centre, where she's worked since 2004. She's also an assistant professor with the Faculty of Medicine at the University of Ottawa. Dr. Canil graduated from the University of British Columbia with a Bachelor of Science. She completed her medical school and her internal medicine residency at the University of Toronto, and her medical oncology residency at McMaster University in Hamilton. She's touring the country. Dr. Canil then went on to complete a 2-year clinical research fellowship at the Princess Margaret Hospital in Toronto, and her focus there was on genitourinary cancers, which are cancers of the urinary tract. Dr. Canil's research interests include drug development in genitourinary cancers, and she's a member of the Kidney Cancer Research Network of Canada and the Ontario Provincial Program in Evidence-Based Care for the Genitourinary Cancer Disease Site Group. So tonight, Dr. Canil will be speaking to us on kidney cancer survivorship with a slant to the medical oncology perspective. So ladies and gentlemen, please join me in welcoming Dr. Canil.
Great, thank you for that lovely introduction. And it's lovely to see so many familiar faces here today, not only patients, caregiver, friends. We also have the support of our healthcare teams, our nurses, fellows, and also our supporters from the pharmaceutical industry. And I must say, it's always a pleasure to work with KCC. I think that this is a phenomenal group. The membership and the leadership, it's such a success story, and you know, the medical physicians like myself and Dr. Caggianos enjoy tight collaboration with this group, and I think together we've made amazing strides and have really benefited cancer patients with kidney cancer in Canada. So thank you for inviting me to be here. It's such a pleasure. So today what I want to speak about is kidney cancer survivorship, looking towards your future. And survivorship, gosh, that wasn't even a word I really understood, you know, a few months ago. So I've learned a lot in the last couple of months, and I think this is a really important field of cancer for all of us. So I hope to enlighten you, and together we can move forward to improving survivorship for kidney cancer patients. So I've got a little visual here. I thought this was a nice analogy for sort of survivorship. You know, we think of cancer patients who make it through such a difficult time, and here we have this little plant that's surviving this harsh environment. And so what I'd like to do, hopefully through my discussion about survivorship, see ways that we can foster this plant to survive and flourish. So at the end of this presentation, I hope that you all have a better understanding of what's meant by cancer survivorship, to discuss the role of survivorship care plans and how we can tailor these to kidney cancer survivors, and also identify some resources, particularly in our community in Ottawa, to enhance cancer care survivorship. Oops. So how do we define a cancer survivor? Well, first of all, I'd just like to review here the cancer journey. So initially we talk about prevention, because ideally we don't want anyone to get cancer, screening techniques to detect cancer in an early stage, diagnosis and treatment, and hopefully for most patients, recovery. Unfortunately, some patients who recover from cancer, it relapses and they require further treatment. And some people end up dying of their cancer and require palliative care. So traditionally, when we think of cancer survivors, most people kind of think of this group of patients who've been diagnosed, have been treated, and are now in the recovery phase. And here's a little picture of Lance Armstrong. He's one of the famous survivors of cancer, and he's helped to establish this Live Strong program. This is a survivorship center of excellence network, and what it does is it provides support for the emotional, physical, and practical issues that people recovering from cancer face. But I think it's important to know that maybe cancer survivorship involves a broader base. So definition number 2 is calling all patients diagnosed with cancer survivor, despite if you're in the early diagnosis, treatment phase, recovery, or if you're in palliative care, you still are considered a cancer survivor. So here, definition number 2, cancer survivor is any individual from the time of diagnosis through to the balance of his or her life. In the US, greater than 10 million people are alive with a personal history of cancer. So you can imagine in Canada, we're talking about greater than 1 million people. And some of these individuals may suffer physically, psychologically, or economically. And finally, the third definition of cancer is not only talking about the individuals diagnosed with cancer, but also the other people that are involved in their lives, their family, their friends, and their caregivers. So the new paradigm is, in terms of a definition of survivor, an individual is considered a cancer survivor from the time of diagnosis through the balance of his or her life. Family members, friends, and caregivers are also impacted by survivorship experience and therefore included in this definition. So all of you here are cancer survivors. So what is cancer survivorship? Well, cancer survivorship is looking beyond just the treatment for cancer, looking at the other aspects of health. So here at the City of Hope, which is a U.S. organization, they've broken it down into 4 components. So physical well-being and symptoms, so looking at functional activity, strength, fatigue, sleep, rest, overall physical health, fertility and pain, for example. Psychological well-being, control, anxiety, depression, some people may experience, talking about enjoyment and leisure, fear of recurrence, issues with cognition and attention, the distress of diagnosis. Social well-being, family distress, role in relationships, affection, sexual function, appearance, isolation, finances, work, and finally spiritual well-being, so the meaning of illness, religion, transcendence, hope, uncertainty, and inner strength. So what are some of the barriers that are faced towards developing the optimal survivorship care? Well, our medical system is a bit fragmented. You get one thing here, one thing there. It's not very cohesive. Quite honestly, there's a lack of education and training amongst health professionals, and that's why I'm so happy to see some of the nurses here because they are interested in this subject and want to help patients. There is truly a lack of standards of care for survivorship. Sometimes there's difficulty in communication between patients, physicians, and also family doctors, and also the capacity to deliver appropriate survivorship care dealing with the number of patients that are in this situation. So this is a problem that's been identified, and this gentleman here, Fitzhugh-Mullen, in the US, was a founder of the Institute of Medicine and a cancer survivor, and he acknowledged this deficiency, and this is a quote that I found that I thought was very good. He said, "Despite the success on the treatment front, we have done very little in a concerted effort and well-planned fashion to investigate and address the problems of survivor. It is as if we invested sophisticated techniques to save people from drowning, but once they've been pulled from the water, we leave them on the deck to cough and splutter on their own in the belief we've done all that we can." And I don't think we've done all that we can. So this gentleman, along with some other people, together formed the Institute of Medicine, and in 2005 they published this manifesto, which involves roadmap for survivorship issues, and it's called From Cancer Patient to Cancer Survivor, Lost in Transition, because what they found is that people were having difficulty moving from this role to this role. And it's kind of frightening to think that this is only 2005 where these issues are being acknowledged. This is an issue that's been around for decades. So together this group came up with 10 recommendations that I'm just going to go through briefly, and then I'm going to focus in on some aspects of it. So what they wanted to do was raise awareness of the needs of survivors, develop survivorship care plans, which I'm going to talk about in more detail, develop evidence-based clinical practice guidelines, develop quality of survivorship care measures, support for demonstration programs to test models of coordinated interdisciplinary survivorship care, so that's all of us working together. That a comprehensive cancer control plan must include consideration of survivorship, educational opportunities for healthcare professionals, and in looking at minimal adverse effects of cancer on employment, adequate and affordable access to health insurance, particularly in the States, and increased support in survivorship research. So this served as a benchmark, and this is being taped. This is what Ottawa looks like right now. Beautiful, sunny, fall. So I'd like to spend a little time talking about survivorship care plans or roadmaps for patients. So in this IOC report, the second recommendation was for these survivorship care plans. So they felt that patients should be provided a comprehensive care summary and follow-up plan, i.e. a survivorship care plan, that is clearly and effectively explained to all patients who have completed active cancer treatments. All individuals completing primary treatment for cancer should receive a written treatment summary and a follow-up care plan tailored to the person's cancer and their treatment experience. So what are the key elements of a survivorship care plan? So a survivorship care plan should include these elements: information regarding diagnosis, treatment details, complications or toxicities experienced during treatment, potential risks, surveillance, which speaks to appropriate follow-up. Who are your caregivers? Who do you go to if you run into problems? How do you get a hold of them? Who's responsible for what? Psychosocial issues and preventative barriers. So here's an example of a program that's available on the web through OncoLife, which is sort of a building block for a survivorship plan. And so what they do, it's probably hard to see, but basically they have this information that you punch in about your specific situation, and at the end it's going to give you a printout of a summary of your treatment and also hopefully recommendations about appropriate follow-up and things that you should be looking out for. So for example, here's one for a breast cancer patient. The diagnosis, the date of diagnosis, what the pathology showed, who was the surgeon, how you get a hold of them, the date of the surgery, what the surgery was, any treatments, the list of the chemotherapies received, who's responsible for that, information on radiation treatment. So this is one individual's sort of survivorship treatment summary, and ultimately they would get a follow-up plan. And there's several of these resources available on the web where you can enter this information to develop a survivorship care plan. What are the benefits of these summaries and survivorship care plans? Well, it improves communication coordination amongst the care providers. It increases patient and family knowledge of cancer treatments and related long-term risks and necessary follow-up. And it improves adherence, confidence, enhances communication and satisfaction in the transition period. And it avoids people falling through the cracks. So one thing I wanted to go through here was a survivorship plan that we could potentially develop for a patient with kidney cancer. So I've kind of made up this patient and I thought we'd go through it together. So this is Mike, who looks suspiciously like the guy from the Discovery Channel. I don't know if you've ever seen Deadliest Catch, or anyways, he's just a regular guy apparently. So Mike is 55 years old, and similar to Karen's story, he had an ultrasound for gallstones, and lo and behold, a mass was found in his right kidney. And he went on to have a CT scan, and the radiologist said, that mass in your kidney looks like kidney cancer. And he saw a nephrologist and was told that he was going to have his kidney removed and had a nephrectomy. And the pathology indeed confirmed that there was a tumor inside his kidney. He had some tests done to see if the kidney cancer had spread anywhere, and fortunately there was no obvious evidence of spread. And he was told, I don't need any more treatment. But I think it's still important for Mike to have a survivorship plan. And so I'm going to go through some of the aspects that I think would be important for him. So I thought we should, in correlation with Kidney Cancer Canada, this is something we could potentially develop. So diagnosis. So what information might be important for Mike to know? Well, it would be important to know what stage he was. What we talk about a T stage, that's how big the cancer is. what sort of histology he has. Clear cell carcinoma is the most common renal cell histology, but as Deb mentioned, some people have papillary, which may carry a different prognosis, a different response to different treatments. Treatment detail, date of surgery, what sort of surgery did he have? Well, I guess what kidney got taken out? Was it a full radical nephrectomy? Did all the kidney come out? Did part of the kidney come out? Were there any complications? I know Dr. Kajianos never has complications with his surgery, but someone may have had to have a blood transfusion. Maybe their other kidney shut down and they needed dialysis, for example. Maybe they had a heart attack during their post-operative recovery. So this is information that may be important to know. Surveillance. So it's important that individuals know, what am I supposed to look out for? What are signs that the cancer could come back? You know, should I be worried if my energy is low, if I'm losing weight, if I have new aches and pains, if I'm suddenly short of breath? Who do I go to if I'm having these problems, if it's possibly related to my cancer? And I can tell, I'm sure a lot of you have that experience where you develop a new symptom and you're like, is it my cancer or not? You know, I don't know. And this is, I just cut this out, but you know, if you know what your T-score is, what size your tumor was, this is sort of a follow-up schedule about how often you should be seeing your physician, having a physical exam. How often should I have a blood test to check my renal function, my hemoglobin? Should I be having chest x-rays? Should I be having ultrasounds or CTs to see if the cancer's recurred? So I think it's important that people have a sense of what is appropriate follow-up. I mean, we're not looking for someone saying to their doctor, oh my gosh, I was supposed to have a scan 1 week ago, you've missed that. It's more a sense of what is appropriate, that you shouldn't be going for 2 years without someone taking a look at what's going on. Who are my care providers? So, for example, urologist's name, their office address, their phone number. Potential risks. Renal insufficiency, you only have 1 kidney. What should I be worried about? Is there any drugs that are detrimental? Should I be on a special diet? Bowel surgery. You've had abdominal surgery. There can be scar tissue. Could be at risk of developing a bowel obstruction at some point. Hernia. And preventative behaviors. Blood pressure monitoring may be important. Probably a good idea for anybody to stop smoking and decrease the chance of any cancer, such as lung cancer or bladder cancer, developing. I've only got 1 kidney. Should I be playing hockey that I could, you know, get a good hit in my other kidney? Is that dangerous? Is that something that's safe to do? So I think this is information that's important for somebody to know. So ultimately, what I would like to see, and I think I've discussed this with KCC, is that we set up some sort of web-based program on KCC website. So for example, and you have these domains, so those box thingies where you would hopefully know your information, you know, get the information, find out what your T-score was. So you can plug these things in and out spits out a report about you and include some standardized statements about potential risks and preventative measures after you've had a nephrectomy, and that you have a piece of paper which summarizes your situation that you could have in your purse or your wallet, so if you end up in the emergency, you can show someone what the heck's happened to you over the past few years. And I think one thing that's very important, and with the KCC site, is that we have information that's obviously approved by a medical advisory board, that's legitimate information. We don't want to give people misinformation. So ultimately what I like to see is Mike at the end of his surgeries, follow up with his physician, he gets handed a piece of paper that has a summary of these things. That would, I think, be the best case scenario. And this is something that a physician could do. This is something that a nurse could do in the clinic, or at least to provide Mike with the information that he can be empowered to do it himself. Now, we talked about Mike, who had his treatment and is now on surveillance. I mean, one can envision this even being applied to patients who have metastatic disease and are on long-term therapy, because with patients who have metastatic disease, sometimes these patients are not curable, but yet they're treatable with drugs, and patients are living longer. They're on chronic therapy. We're changing this death sentence in something chronic, just like diabetes or hypertension. So I think we can kind of tweak this survivorship program so that it's relevant for these people too. So here's Lisa, who's 60 years old, who has metastatic renal cell carcinoma to the lung, who's been on one of the oral therapies that we use for renal cell carcinoma, Sutent, for 2 years. She's had some scans that show she's responding to treatment. So in addition to what Mike had on his plan, For Lisa, we should include information about her treatment. Which drug therapy is she on? When did it start? When did it stop? Is she on second-line treatment? What's her current dose? What's the schedule? And obviously these things are in flux. They could be changed. It's not ingrained. If she's had adjustments in her treatment, why was that? Toxicity and management. Some of the side effects we see with these drugs. She may develop hypothyroidism and needs to be on medication for that. She may develop hypertension and needs to be on a blood pressure medication. So I think this is information that may be helpful for Lisa for her survivorship plan. So what are the potential challenges to implement this thing? Well, funding is always an issue, but I must say, as Deb mentioned, we've had very good support from the pharmaceutical companies in renal cell carcinoma, and they've already expressed interest to me to support this program. And the other issue is uptake and adoption. Physicians aren't always the best at doing these sort of things, and I think it's very important that we get these recognized agencies such as the Canadian Kidney Cancer Consensus Group to endorse these programs and to also say, hey, this is standard of care, this is something you should be doing for the patients to legitimize it. And also I think it's important to empower the survivor, for them to do it themselves and not have to rely on their physician or nurse to do it for them. And as long as this is endorsed by KCC and in the public domain on a website, you can do it for yourself, as long as you have the right information to enter. And then I want to speak a little bit just about local resources. Such resources are available all across Canada, but I'm going to talk a little bit more about what's available explicitly in Ottawa. So we are very fortunate here at the Ottawa Hospital Cancer Centre. We have a psychosocial oncology group that Karen had mentioned. And what their mandate is to look at complete care and address other issues which the physicians, nurses can't address in clinics, such as dietary issues, physiotherapy, psychosocial issues. We have a psychologist, a psychiatrist on board. We also have social workers. So this is all the allied healthcare workers that provide the other aspect of care that's still very important for patients. And so what this program is trying to look is to have a survivorship aspect to it. And what they're looking at is an innovative approach for follow-up of cancer survivors. So why are they looking at changing our current model of follow-up? So right now, after someone has had treatment for their cancer, they're seen by their oncologist every few months. They may need appropriate investigations. But maybe this isn't the best for all our patients. The current model is currently not sustainable. There's opportunity to improve access to quality cancer care across the cancer care continuum. Opportunity to better meet the needs of cancer survivors. We don't address all those psychosocial needs in clinic. And the opportunity to provide care closer to home. We have patients who are coming all the way from Hawkesbury, from Cornwall, from Perth. Maybe some of these aspects of their care could be better managed closer to home. So this is really overwhelming, and I'm sure the nurses all know this. This is one of these care plans. But what I just wanted to focus on was this top aspect. And so these are some issues that have been identified, or sort of different silos. One is active cancer therapy completion, education and support, the development of a wellness care finalization plan, transition to the community care, and also consultation and reentry. You finished your follow-up at the cancer center, you're seeing someone in Hawkesbury, how do you get back into the cancer center if you run into a problem? And what this care pathway does is it gives every individual in the patient's care program some responsibility. So the patient and caregiver have their responsibility and role, the oncologists and nurses have their role, the family practitioner knows what's expected of them, and this is the cancer team and other resources that are available. So it helps to decide who's responsible for what. So what tools and resources are available? What opportunities are there to develop an innovative partnership? Well, they're also interested in developing these survivorship care plans. And when I spoke to Kathy DeGrasse, who's the lead for this, she was very interested to see what we're doing, because they don't want to reinvent the wheel. They want to see what we're doing and just have some sort of website where they can refer to KCC and refer patients to there. They're also developing a website They're promoting education of the family doctor for transition of care, and also formalizing partnerships with some other groups that are interested in survivorship. They're also developing these survivorship care plans, and also I think it's important to identify appropriate community resources in Ottawa that people can go to. And here's the website that they're developing. The other thing I just wanted to mention to complement this, as Karen had alluded to, is this Maplesoft Centre. I like the name of that, Maplesoft. This is through the Ottawa Regional Cancer Foundation. It's a survivorship center. It's been built. This was an artist's rendition, but I'm sure there's something more solid there that's now. So the Maplesoft Centre will offer cancer survivorship care. There's a series of programs and workshops to assist patients and those closest to them through every step of the cancer journey, from pre-diagnosis through diagnosis and treatment, post-treatment recovery. And as Karen was alluding to, they have a few programs that they're looking at focusing on. One is one-to-one care. So it includes a professional navigator to help patients navigate through the very complicated healthcare system, allowing people to have access to a professional health coach. There's also self-care, empowering survivors to take control of their own health through a variety of programs. And some of the programs that they're actually developing are, for example, a program on body, mind, and spirit, which looks at holistic care. They've got journey management, which provides practical advice and information for early diagnosis. And there's also supportive care, where they're developing peer-facilitated support groups. So a support group for young survivors, a support group for bereaved spouses, a support group for gay and lesbian survivors. So looking at different groups that may have common themes and be able to work together. Also, there's been development of this lovely park to help provide, I guess, a calm atmosphere for people for healing. So I think survivorship, this is the land of insurmountable opportunity. Alex Haddad, who's a wonderful physician who does a lot of work with web design and helping people navigate through the web. And I think one thing I really want to emphasize is the collaboration between the medical community and survivors. All of you are either living through it or have lived through it. You have a unique perspective, and I think you have an opportunity to share your invaluable experience and expertise to help us to develop a very good survivorship program for kidney cancer. And what I hope is this little plant that's surviving in the desert will flourish. And so we have a nice lush green lawn with the survivorship. And I just want to thank some of the people that I work with. Myself, obviously, this is Neil Rayom, who snuck in. He's another medical oncologist I work with. Patricia Morato, who is a GU fellow from Brazil, who's been instrumental helping us with our research program, has been working on a survivorship program for testicular patients. This is Fatima Kanji. She's my nurse who works very closely with me, and as Deb had mentioned, probably spends a lot of time, more time than I do, speaking with patients and helping them get through toxicity. This is Carol. She's the patient-designated nurse working with Dr. Rayom. This is Caroline Prue, one of our research assistants. We have an amazing pharmacist, Louisa Gobut, who I think is on your executive, right? She's the pharmacist representative. She's been instrumental to help us to get drug access and help us navigate through some of these complicated drug access programs. This is CCAC, Marilyn Woods, who's been helpful to get patients on home care and help us access Sutent for our younger patients. And finally, this is the PSOP program, the psychosocial oncology program that's provided support for our patients. So thank you very much.